There's been some questions about how to label the diagram of the knee. There's 3 ligaments on that sheet. There's one ligament that's a little tricky to determine what it is. There's also one tendon you have to identify on the sheet, and that's also a little tricky to find or define. I'm going to mention a few things to you in terms of how to define it best. The question I'm going to ask you right now is, what does a ligament connect? 2 things it connects. What's it connect? Yeah.
Bone
to bone to bone, right? Let's throw it out there. Give me a ligament that would be drawn connecting the femur to the tibia. Just throw one out. ACL, right? So we'll draw the ACL. Okay, what else? Give me another ligament. Yeah. PCL. Okay, what about, give me another one. ACL, PCL, what else? MCL. All right, and then we'll draw the MCL here. Okay, good. And there's one more. LCL, right? Lateral collateral ligament. Okay, so now we have our 4 ligaments, right? ACL, PCL, MCL, LCL. So we know that these ligaments connect bone to bone, the femur to the tibia. Now let's draw the patella. So now we know, as drawing the patella, it now covers the middle of the knee. So we actually, with the patella in the way, we cannot see the ACL or the PCL anymore, correct? So what of the grafts? There's a few grafts, right, that basically are used, tissue grafts that are used in order to reconstruct an ACL. So give me one of the grafts that are used to reconstruct the ACL. Yeah. So of the grafts that are considered autografts, give me a tissue that's used for the autograft. She's right, but let's detail it, break it down a little bit more. What would be one tissue that is used for ACL reconstruction from the article you read before last week? Anyone?
I don't know how to say allograft.
Okay, so allograft is different than autograft, so it's separate. So allograft has its own category, but there's autograft has tissue samples or tissue specimens that come from the tissue of that's harvested from the person's body. Do you guys remember one of the autografts that are used? Yeah, Marissa. Okay, good. Bone, patella, tendon, bone, right? Bone, patella, tendon, bone. What else? Yeah. Quadriceps, right? And then the third one would be hamstring, right? So there's a third one that's hamstring that we covered. And then there's cadaver that's considered the allograft that's not from the same person. Let's speak of quadricep. So the quadricep muscle is in the front of the thigh. Ligament connects bone to bone, right? What does tendon connect? I don't know if we've covered it before, but take a wild guess. Yeah.
Muscle to bone.
Muscle to bone, right? Tendon connects muscle to bone. So let's talk about this for a second. So, well, let me just write it. So the quadricep's in the front of the leg. So let's draw the quadricep. So the quadricep muscle attaches to the patella, right? And if you remember before, when I showed you what the back of the patella looks like, right? And we basically showed you how the quadricep tendon here that travels down and then attaches to the patella. And the patella actually is kind of encompassed by that soft tissue. So as it travels down, it attaches to the bone. So this is a quadricep muscle. It attaches to the patella, which, if we go with the definition of tendon is tissue that attaches muscle to bone. So if this muscle is a quadricep muscle and it attaches to the patella, then that would mean that this area here would be considered a tendon. Now, if I were to continue the tissue, which I'm going to, and I cover the patella, and now I attach this continuation of the tissue to the tibia. As it travels and covers the patella, as I showed you here, and then it transitions down inferior to the patella, it now connects the patella to the tibia. Which my question for you would be, is this a ligament now or is it a tendon?
Ligament.
It's a ligament, right? It's a ligament because now it connects a bone to another bone. So when you're labeling this particular picture, there's two things that are going to stand out to you. You're going to be like, which one is the third ligament? Because when you look at the image, it looks very similar to this. And you're like, well, I see the MCL, and I see the LCL, and there's actually another ligament that's kind of drawn in for you, like at the fibula. And you see a ligament there as well, which is actually indicated on a previous sheet. That's not the ligament I want you to label. So what I want you to label is I want you to label this ligament here, which is the what? Yeah.
The patellar ligament?
It's the patellar ligament. And then this would be the what tendon? Quadricep tendon. So just know that this section here and then this section here is considered the tendon named by this particular muscle, and this is the ligament named for that particular bone that it attaches from.